handlebar breaks go through ribs. It's possible, right? You have a, external chest wound, and you want to do the three-sided seal, right? You typically want to use some type of, we didn't bring it in, but you know what you wrap ice bags with? You have an injury,
Saran wrap?
yeah, basically saran wrap, okay? You can also use a glove for this, okay? So let's just assume this person has a chest wound somewhere on the chest, okay? So you want to cover, yeah, sucking chest wound on the face. All right, so you're going to cover the area, okay? And you're just going to tape down 3 sides. Any type of tape's going to work. Again, if this person's hairy or wet, same thing that you're going to apply with the AED. You want to make sure that it actually sticks. Okay. So you're sealing 3 sides. And again, if this is all you have to work with, you make it as good as you can.
If you're in a scenario like this, the best thing that you can do outside of providing the care is stay calm yourself and do your best to calm that patient. You guys were talking about shock today. You're going to know if you're freaking out, they're going to pick up on that. They're going to freak out more than they already are. If they have a hole in their chest, they're going to be freaking out. But if you go to like, oh my God, somebody help, oh wait, that's me, now you just freak them out. They're going to go into shock. Remain calm and keep them calm.
Yeah, remember, one of the first things we learn as a first responder, you think, okay, you're trained to provide the actual practical medical whatever, right? But the big part of that is you have to manage the situation, right? So again, being calm, reassuring, composed, right? Okay, so here's your sucking chest wound seal. Okay, so you're going to seal 3 sides. So the idea here is when they go to take a breath in, this loose flap will stick down to the body, right? So air is not going into the pleural space, right? Because that causes pneumothorax, and you can get attention pneumothorax, which can cause cardiac arrest, right, amongst other things. And then as they breathe out, this flap will allow air to perfuse out. It doesn't matter. Typically, you want to do it towards the side, so if you get them into a recovery position or something, it's just on the downside, so if there's stuff coming out that you don't want to get on you, okay? Right, so that's a makeshift. So any type of, you could do this with a gauze pad if you needed to. It's not as favorable, but again, whatever resources you have, I can't say it enough, if you're working in that setting, you're going to be prepared, right? So if you know you're working a BMX or motocross event and you don't have a med kit with the tools that you'll need, then you're not prepared, okay? So that's part of the initial scene safety, making sure you have all your equipment, okay? So that's for sucking chest wounds, all right? Let's do impaled object, okay? So Dr. Shane's going to show us. So